After PGPCET, if you are confused on how to decide which colleges to fill in the preference list, then you have clicked on the right video. In this video, I'll be sharing the things that I have learned when I went through this process of deciding how to fill the colleges, and now I'm in my second year. In the past 1.5 years, I have realized what mistakes I've made. In this video, I'll be sharing those with you so that when you go through this process, you don't repeat the same mistakes. I am a second year postgraduate student, and after being in the college that I have got, I have learned a lot of things. First and the most important thing, and the only thing that matters, I have realized this by now, that the patient exposure of the college is what matters. What are the amount of patients and what are the type of cases that you get to see in that college? Every college has got its hospital, and if they don't have their own hospital, then what are the other attachments? What are the other clinical postings that the college has? That is the most important thing that you need to check. If the college does not have their own hospital, what are the other postings that the students are being sent to? For every elective, this is important because you are now specializing. So it is now you are specializing into a certain branch. So it is important that the next 2 years you get to see a good amount of cases of that particular branch. If you have opted for musculoskeletal, then it is important that for the next 2 years you get to see good OPD and IPD patients of musculoskeletal cases. If you have taken CVRS, then it is important that you see good cardiac and respiratory cases. You get to see good OPD and IPD cases, and this is applicable for every elective. So first and the most important thing is deciding which elective you want to get into. Next, checking whether that college has ample amount of cases for that elective. Now, how will you come to know that? You will not be able to understand that just by seeing what postings that college has. You will have to speak to the students who are studying over there, because the best information can be given by those who are currently studying. A college can have 5 different postings, but it is not necessary that each posting has a good amount of cases, or a particular posting has the cases that your elective needs. For example, if your elective is musculoskeletal, but it is not necessary that the posting has a good amount of musculoskeletal cases. That hospital might have good CVRS and neuro cases, but not necessarily MSK patients. So this is a little in-depth analysis that you will have to do. But if you want to make the next 2 years count, and if you want that you make the 2 years the period where you get to learn and where you get to see good amount of cases and more number of patients, then this is what matters. For musculoskeletal, you need to see that if the college has an OPD for the OPD cases, then IPD is important so that you get to see post-operative cases immediately after surgery that you will get to see in the hospital. So for that, IPD posting is important. Next, for neuro patients are seen in the OPD, IPD as well. Now, many colleges have good amount of patients in the OPD for neuro, and IPD for IPD, then you need to have good attachments where you get to see cases in the ICU, where you get to see patients who've admitted. Now, for CVRS, you need to have a good load of respiratory and cardiac cases in the hospital. You don't get to see a lot of CVRS patients in the OPD. CVRS patients in the OPD are comparatively lesser. Then for community, you need to check whether the college has whether the college has attachments to primary healthcare centers, old age homes. Like this, based on your elective, understand whether the posting is appropriate or not, and you will only be able to judge that by speaking to the students who are studying over there.